My name is Kirsi Markkola, and I'm from the Finnish Association of Physiotherapists. And I'm very pleased to get this invitation to this very interesting happening. And yes, my background, I have worked in Finnish Association Physiotherapist from last September. Before that, my clinical work is from specialized hospital in southern Finland, and I worked there 37 years with children, neurological children and other things. And I have to apologize, English is not my home language, so if I say something stupid, you must correct me. And if I miss some words, I'm that age that I can miss words even Finnish. And this presentation, the objectives of this presentation are something facts, something challenges, and possibilities. And Finnish Association of Physiotherapists, FAP, is a joint professional organization looking after the interests of all physiotherapists. FAP promotes physiotherapy in Finnish society and ensures the physiotherapists have the readiness to provide high-quality physiotherapy services in different areas. In order to monitor its members' interests, the FAP actively follows developments in the Finnish society, provides statements, takes stands, presents proposals and introduces initiatives. We have about 9,000 members, but not all physiotherapists in Finland are not our members, but we have about 9,000. And what we think is physiotherapy, physical therapy, and that statement is from World Confederation of Physiotherapy from the year 1999. That's still going on. Physiotherapy, physical therapy, both of those words are using, and I think they mean same thing. It depends who is talking about. Is concerned with identifying and maximizing movement potential within the spheres of promotion, prevention, treatment and rehabilitation. Physical therapy involves the interaction between physical therapists, patients or clients, families and caregivers in a process of assessing movement potential and in establishing agreed upon goals and objectives using knowledge and skills unique to physical therapists. Why I use these big word around the world coming regulations is because we belong in European Union to that big confederation, and that's why we don't do our own rules, but we belong to the bigger area. And the next one, physiotherapist. Who is physiotherapist? This is from European region. We see PT. A physiotherapist is an autonomous healthcare professional who assesses, diagnoses, plans, treats and evaluates clients or patients and is responsible for his or her own actions. The physiotherapist has their own caseload of clients or patients. with complex needs and practices within a complex and increasingly unpredictable context. A physiotherapist practices according to professional codes of practice and conduct. And what it is in here in Finnish social and healthcare system. All physiotherapists are registered, licensed, and the title is protected. And we have this National Supervisory Authority of Welfare and Health, we call Valvira, which controls and supervises physiotherapists. So they accept certain quality, and you need to be graduated from the education to physiotherapists. And the physiotherapy education in Finland. As there was in the former presentation too, physiotherapists are educated at universities of applied sciences, and the bachelor degree consists 210 ECT points, which means that 3.5 to 4 years is full-time study. Education is arranged at degree program. The curriculum is instructed by ARENE, the Ministry of Education and Culture, the NEPIGE, which their recommendations and descriptions of competencies. You can continue to master degrees too. We have one university here in Finland, it's Jyväskylä, but all physiotherapists don't continue, it's voluntary. So one place, but 15 universities of applied sciences where you can study physiotherapist. And one place, it's in Pori, southwest coast in Finland. There is international English language course to physiotherapist education. And what we need to know, these rules and regulations and directives from European Union, we need to respect and not forget when we are educating physiotherapists. I think these all are familiar to you, isn't that so? Because in every country in European Union we use this. But this ARENE, the last one, this is my own translation, the Council of Rectors of Universities of Applied Sciences. I don't know what is official English translation, but we call it ammattikorkeakoulujen rehtorineuvosto. And these makes those curriculum. Nowadays, from 2012, we have this SORA law. It is to ensure safety to the patients and clients, the main point, and the other one is, of course, quality, which all European Union is calling for better safety in education and after that in work by allowing more possibilities to those who organize education to prevent students from studying if the student is not appropriate for the profession. This is the legal system here, but this is mainly because this law includes all those things which might be to be a border or why you can't study some profession, for example, nowadays drugs using and so on. But the basic rule is that problems in health or functional ability of the student can't be the barrier to the study. So everybody in Finland can go to the student if they want and they go through the tests. But because there are different visions about these things, it's very good that all kind of things are that we discuss these things, because as we all know, world is going forward. The ball is rolling all the time, and new systems are coming. So, in spite of that, we have this kind of laws. There is always possibilities to find different things where those people who don't have any barrier to study the whole education can do that. I don't know if you understand what I'm saying, but maybe I use stupid words. But it's individually they look, all those who are coming inside to the university. So you have possibility to go, and I know that there has been few students in Finland who has visual impairments, and it was last December when one was graduated physiotherapy. It was in Seinäjoki. Yes. But we don't know if there is blind student in our country. But those who are blind or stronger visual impairments are working in Finland, but they have studied physiotherapists before they have this problem. So it's easier then, because you can make your own order and specialization what you are doing when you handle the whole area, but you can't do all those things anymore. It's easier then. But I'm very keen to hear what are the new systems today that you can study to physiotherapist. So, thank you. I'm very sorry I can't stay all day, but little more. That I need to be somewhere else. But they told me that I get all the information afterwards. Thank you.
May I have one question? Do you have, how many visually impaired members do you have in your association?
Actually, we don't know, because we don't keep those healthcare knowledge, but we don't know who has healthcare problems. But I've heard that there are few who are working, but I don't know if they are our members.